year in America, roughly 40% of the population will visit an emergency room, either through walk-in visits or emergency transport services, such as ambulances and lifeline flights, all seeking prompt care for critical and benign injuries and illnesses. Emergency rooms play a critical role in not just the American healthcare system, but in every system around the world, acting as a first option for potentially life-threatening or debilitating afflictions. However, many emergency rooms are plagued by long wait times, crowded waiting rooms, and a decrease in the quality of care. But why? Surely, with such an important role to play, emergency room management would prioritize these issues and increase staff numbers. Well, it's not so simple. In 1 year alone in the United States, emergency rooms recorded 145.6 million visits. 30% of those visits were deemed otherwise unnecessary. This costs hospitals $8.3 billion. As a result, wait times increase over 15 minutes, 61% of the time. Some of this can be avoided. The price of healthcare for a patient is often painful, even on the taxpayer level in countries where it's nationalized, but it can be alleviated. Emergency room visits and procedures are often the most expensive, leading to the highest costs. Unfortunately, there are times when an emergency room visit is wholly unnecessary. Common injuries and illnesses often result in understandable visits to the emergency room. These cases ranging from the common cold and flu or similar symptoms to severe cuts, broken bones, and anything related to head trauma. These are known as acute illnesses and injuries, or incidents that have occurred relatively recently, often without warning or precondition. Afflictions such as these are typically examined, diagnosed at the emergency room, while continued care is usually transferred to a primary care physician or specialist outside of the department. Emergency rooms may refer a patient to an outside party, but don't always have the resources to treat every issue in-house, but specialize in life stabilization and treating the most common ailments. As such, many emergency rooms do not have the ability to properly treat patients with chronic ailments or illnesses and injuries that have been ongoing for a long period of time, sometimes with repeated treatments. These can range from constant lower back pain, insomnia, long-standing headaches, joint pain, gastric reflux, and many other long-term health issues and diseases. While emergency rooms will attempt to accommodate chronically ill visitors, they will typically refer to resources outside of the department if available, or send them to their primary care provider. While acute issues resulting from a chronically ill patient is a concern, long-term issues generally are not and cost patients and hospitals a great deal of money. In order to address chronically ill patients, it is absolutely imperative that they refer to their primary care providers treatment to avoid unnecessary hospital visits. Primary care physicians or family doctors can address chronic issues at a more measured pace and with greater scrutiny than a busy emergency room. Generally, these physicians will also have more information available to them about the patient's medical history, giving them the ability to make a stronger judgment on the ailment and be able to pinpoint and narrow down treatment options more appropriate for the patient. Ultimately, it is the patient's responsibility to help medical professionals better tend to them and understand the necessity of reporting to an emergency room or primary care doctor. This, in turn, would help emergency rooms by lowering the volume of unnecessary visits, lower wait times, and increase the quality of care.